The Human Sciences Research Council has called for urgent intervention to address food insecurity in KwaZulu-Natal. The institution released its survey on the current food and nutrition status in Durban. The report revealed that the province faces a severe problem of obesity and food scarcity, especially in some rural districts. 30 scientists worked on the survey. For more on this, let's now welcome and bring in Professor Thokozani Simelane, Professor of Practice at the Human Sciences Research Council. Prof, thank you so much for your time. We do understand, of course, that your field workers didn't only limit their research in KZN, but they visited more than 34,000 South African households in all 9 provinces. What does the study reveal just about the severity of food insecurity in the country? I mean, many have gone as far as saying that the country is experiencing a hunger crisis.
Thank you, Bonati, for having me, and greetings to viewers at home. Certainly, as you have indicated, this survey was so much in-depth in such a way that we visited the total number of households that you have mentioned, more than 43,000. And basically, the intention of the study, or the purpose of the study, was to do a thorough investigation of the state of food insecurity at a household level across the country. And what has transpired or emerged out of this survey is that really, indeed, the country is undergoing a severe state of food insecurity at a household level in South Africa, despite the fact that today we were just sharing and presenting the results and the report for the province of KwaZulu-Natal.
Now, we understand, of course, as you rightfully say, that it was commissioned by the KwaZulu-Natal provincial government in an effort for them to see whether interventions by the provincial agriculture departments were actually bearing fruit. I mean, did it come as a surprise that the situation in urban areas was as severe as in rural areas? And how will this assist in, those targeted interventions that I would imagine are needed?
The study, just for a point of correction, was actually commissioned by the Department of Agriculture, Land Reform and Rural Development, with the provinces being the contributors and the beneficiaries of the results that we have come up with, to such an extent that each and every province has got its own report that put into details the situation of food insecurity at a household level. The findings that there is an intense food insecurity in urban areas actually came as a surprise, because we have been living in the belief that the urban areas are relatively more better off than the rural areas. Hence, as I've been emphasizing previously, is that there is this kind of a shift which emanates from the fact that while the urban areas don't have sufficient land and space to produce food, the rural areas has totally abandoned the agricultural practice, and then this equates the situation in both rural and urban areas. Secondly, the critical point of concern is the unemployment rate that is in the country, and over and above that, the dependence on the social grants, the pensions, and all those kind of incomes that are not really sufficient to allow the household to buy enough food for consumption.
I mean, just in terms of the interventions then, I mean, what the study is basically saying is that the urban areas are very much affected by the food insecurity because of the limited land. The rural areas, because of the agricultural activities of production, have essentially been abandoned. So in this, I'm particularly interested in the rural areas where this part of, agriculture is abandoned. I mean, from a targeted intervention perspective, what are you recommending?
Basically, the study itself originated from the concern by the department that there are a lot of programs that are being implemented in South Africa. I'm sure you want to agree with me. We have a school feeding scheme, we've got the pension schemes, we've got a number of them that actually total closer to 113 programs. The concern was that in as much as the country has these programs, what impact are they making at the household? so that the government can improve on its intervention measures. To that effect, that's when we have to go deep into the household level to determine whether the government inputs or the interventions, the communities are aware of them, are they benefiting out of them, or maybe there is a need for improvement. And indeed, we came up with the conclusions and the findings that in as much as South Africa has so many number of intervention measures by various departments, these intervention measures are not making any significant difference. Maybe it's because they are not targeted enough, or probably maybe people are taking them for granted in such a way that they solely rely on these programs as the main means of assessing food security. That is a critical finding that we have found out. So the biggest intervention measure which was put forward is that people need to be encouraged to produce their own food.
And Prof, just as a parting question, I'm afraid the line is not that great, but the Eastern Cape, is also experiencing severe challenges as well. We saw how children as young as 5 are dying of malnutrition. So how important is it then, to understand how measuring food security is more, and it's much more than just estimating the volumes of food, but also has to do with nutrition?
I'm glad that you are making use of Eastern Cape as a pointer or as a point of reference, because we have to understand that at a system level, Eastern Cape has 3 systems of food production that derive from the fact that there were 2 independent homelands in Eastern Cape, together with the Republic of South Africa that was existing there. So we had a Transkei system, a Ciskei system, and the South African system. So when the democratic government came on board, there were assumptions that this system can be easily blended together, of which what we are now aware of is that in reality, that couldn't happen. These systems still exist separately in an extent that people totally abandon the agricultural production, because again, the larger part of the Eastern Cape province is rural and no agricultural activities are happening there at the moment. Now, coming to the food, I think you again mentioning a very important point, in the sense that the quantity of food doesn't matter. It's the quality of food in terms of the nutritional value that is significant, in the sense that people can wake up in the morning and eat a loaf of white bread with tea or whatever, and then they fill their stomach and say they are sufficient. They have eaten in that particular day. Hence, that meal may not necessarily be nutritious enough to give them the required nutrients which can make them healthy. So this is the reality that we are having, because in most schools, for instance, you will agree with me that outside the gates of the schools, there are children or mothers who are also deriving a life out of this. They are selling makwini, they are selling quarters and so on and so forth. Yeah. This is the reality that we are having, where there is an easy access to food that is only filling the stomach rather than providing the nutritional value which the body requires.
Prof, thank you so much for your time. That's where we have to leave it, I'm afraid. Professor Thokozani Simelane, Professor of Practice at the Human Sciences Research Council. Unfortunately, not a clear line there. Of course, this comes at the back of that research by the Human Sciences Research Council, just addressing the urgent interventions to address food insecurity in KwaZulu-Natal and, of course, the rest of the country.